Dr. Inayah Zaheen Ahmed, thank you for giving us your time. You are currently serving corona patients in Britain at a hospital in East London. Could you please explain us what is the situation over there at this moment?
So currently we've seen that the coronavirus cases have more or less remained static, with the peak for us in our hospital having been about 1 or 2 weeks ago. So now, while these cases are definitely less than they were 1 or 2 weeks ago, they're still not anywhere near normal or anywhere near being outside of the pandemic. So they are, I would say, at a slow downwards trajectory, but still pretty static in the new cases that we're seeing. Having said that, there is definitely a new incidence of the cases that we didn't see 2 weeks ago. So 2 weeks ago, we were seeing 90% to 95% coronavirus only patients. And now I think we're seeing the patients who didn't come to hospital at that time, either because of fear or because they weren't able to come to hospital. And now they're coming with heart problems or exacerbations of diabetes and this kind of thing that was probably delayed a little bit because of the initial wave of the coronavirus. And we're definitely seeing a lot more of those alongside our coronavirus patients.
What kind of treatment corona patients are receiving? What kind of drugs are being used?
So the main thing to note is that in the UK and the USA, all over the world globally, the health community and doctors, we use something called evidence-based medicine. And the most important thing about evidence-based medicine is that evidence behind any drugs or medication that we use has to be very robust, and it has to be something that's checked and rechecked alongside data. So to collect data, we need to do studies and we need to do trials. Coronavirus has only been around for 3 months or 4 months, so it's very difficult to gather data and trials that we need for sufficient amounts of evidence for the medicine that we are doing. Therefore, as such, there's no medication or no drugs that are licensed in the UK for use against coronavirus, and there is nothing yet that we use regularly. However, I know there are several trials and several different experiments that are going on in the USA and the UK, ranging from general medications or malaria medications, and also ranging all the way to donating plasma, so blood, from patients who have recovered from coronavirus to donate to people who have coronavirus to see if the antibodies from those patients can help. Now, these are all being trialed, and there's still nothing that is a hard or fast treatment for coronavirus. So the way that we support our patients is with oxygen, if they need oxygen, and if they then need with ventilation as well. Some patients receive antibiotics, and that is more because we want to prevent other bacterial infections from the lung damage that coronavirus causes, and otherwise we just support the body to try and get better by itself.
This is a month of Ramadan. As you practice medicine, as well as you are a frequent writer on various religious topics, I would like to know how we can fast safely during this pandemic.
So the most important thing is that if somebody is well and is not suffering from symptoms, then there should not be any problem with them fasting as usual. There have been some studies, although not about Ramadan in particular, there have been some studies about fasting and the benefits that it has for the body. So intermittent fasting has a lot of benefits, and staying without food for several hours can even help the immune system sometimes. So with that in mind, if somebody is well and not showing symptoms and does not have any preceding predisposing immune conditions or diseases, then fasting should be fine for them, as normally they can do. Now, anyone who suffers from an existing medical condition, there may be some conditions where they would not have fasted anyway, and there may be some that actually will be affected by this pandemic and may weaken them. So it's really important to speak to doctors about it. We have in the UK the British Islamic Medical Association, and they've published some very useful guidance for different patients from different different diseases and how they should approach fasting. It's quite a simple method. They've produced a publication that has 3 columns, a red, an amber, and a green. And red denotes somebody who definitely should not fast. Amber is somebody who should consider not fasting but may be able to fast, and green is somebody who's deemed safe to fast. And what they've done is split that up alongside lots of different medical conditions. So it's definitely worth a read and definitely worth speaking to different doctors. But overall, fasting should not be something that's definitely stopped in Ramadan if someone's healthy. But paying attention to what food we eat and how we're nourishing ourselves and our bodies is really important, not just in a pandemic, but any time in Ramadan, and making sure that we're maximizing on vitamins, maximizing on minerals, maximizing on vegetables and fruits, and all of the things that are good for us will only be beneficial for us in Ramadan as well as outside Ramadan.
Dr. Inayah Zaheen Ahmed, thank you for giving us your time.
Thank you.